Well, welcome everybody. We'll get started on time so that we can all get back to our evenings. I'd like to say good evening and welcome to tonight's webinar on the My Health Record and electronic referrals. Thank you for taking the time out of your evening this evening to join us. My name is Angela Heathcote and I'm from Eastern Melbourne PHN. Together with my colleagues Kirsty and Josie, we welcome our guest speakers tonight, Kathy Rainbird from Australian Digital Health Agency. Eastern Melbourne Primary Health Network is primarily funded by the Australian Government to improve the care and support people receive from health services. We aim to improve the health of our community, which includes using technology to make the broader health system work more efficiently. I'd like to begin by acknowledging the Wurundjeri people and other people of the Kulin Nation as the traditional owners of the land on which our work in the community takes place. We pay our respects to their elders, past, present, and emerging. Tonight, we'll be discussing initiatives such as the My Health Record and how these may assist you in your practice and care coordination. Before we begin tonight, just to let you know that we are all on mute. You can ask at any time questions by typing them in the chat box. For those questions not covered in the presentation, our guest speakers will be more than happy to answer these at the end of their presentations. Tonight's webinar is also being recorded and all attendees will receive an email with a copy of this recording, a copy of the presentations and also any relevant resources from tonight. At the end of tonight's webinar, you'll receive a short survey, so I'll be very grateful if you could please take a minute just to answer these at the end. So without any further ado, I'd like to hand over to our first speaker for the night, Kathy Rainbird from the Digital Health Agency. Thanks, Kathy.
Thank you very much, Angela, and thanks for having me. My pleasure to be here this evening. As Angela's mentioned, my name is Kathy Rainbird and I'm from the Australian Digital Health Agency, and I'm going to be focusing primarily on My Health Record for specialists and how it can help you deliver better patient outcomes for your patients. So a bit of an overview of the presentation that I'll be going through. First of all, I'll give you a general overview of what My Health Record is and what it can do, some of the current statistics and some of the key information that's available through the system. We are doing a bit of a live demo, but I should point out that all the documents that I mentioned tonight are also available across a whole range of different other systems. So it's not just Genie specific. You can access them through other software if you're using conformance software. And if you don't have software, there's even another way that you can do that. I'll talk about that later on. So I'll give a little bit of a live demo of accessing some of that key information that might be particularly relevant to you as specialists, and also talk about the new functionality that's been built into some of the software, including Genie, which allows you to upload your specialist letters. I'll talk about how you can get connected, what you need to do to get through that process, and point you towards some of our resources. And then, of course, time for questions. So the Australian Digital Health Agency has been tasked with working across the country to deliver our national digital health strategy for Australia. That strategy was co-designed with all states and territories, and we worked closely with a number of peak clinical bodies and primary health networks, such as Eastern Melbourne Primary Health Network, to deliver this roadmap and now to deliver the projects that underpin that roadmap. And My Health Record is just one component of that National Digital Health Strategy. I really do like this slide though, because the little comment under that pillar of My Health Record really sums up what My Health Record is all about. Having health information available wherever and whenever it is needed. And I'm sure that you working in specialist practice are aware how often that key information that you need isn't available at your fingertips, and how useful it would be if you could just click a button and get to that information. And that's really why My Health Record's been created, because we know that all the different health and computer systems don't necessarily talk to each other or share that information. This is a way of having that summary information available as it's needed. So that brings me to what My Health Record is. And I should point out that it is just a summary of an individual's key health information. It doesn't replace your existing medical records or how you keep track of your practice notes, but it provides you with an additional source of information, and information that you may not have directly received. And as I said, it's just a summary of that information. So it's not a complete record. It doesn't have the complete information from that person's GP or from other sources, but it can have some really key information that you might not have directly to hand. It is also personally controlled in that the individual who owns their My Health record does have the opportunity, firstly, to choose whether or not to have a My Health record at all. The positive news in that space is that more and more people have been actually choosing to have one, even though we went through that stage where most people were automatically enrolled to have one. But there are also controls that individuals can put over their My Health record to either restrict the whole record to only those people who they share a code with, or also to only allow certain documents to be accessed. So you need to be aware of that as a clinician as well. The beauty of it, of course, is that it is part of a national system, so that wherever you are working across the health system, you can find that key information. And if you're seeing people from interstate, if they're able to travel interstate, that information is really useful for other clinicians to be able to access as well. I know quite a lot of you are joining from Victoria, and a lot of those patients who perhaps might be travelling up and escaping Victorian winter, going to Queensland, and they can have that information available when they go up there and perhaps hitch up their caravan and stay up there for a couple of months over winter. The beauty, of course, as well, is that it is accessible at all times, provided you have connection to the internet. And there are security protections in place to keep the information within My Health records safe. And that includes that the software that integrates and talks to My Health record has to go through some pretty stringent technical requirements to meet the specifications to be able to actually connect. And there are also digital security certificates that work in the background. So the good news is that we've been working closely with primary health networks, as I mentioned, and a great focus for them and the agency has been on getting a lot of the initial connections up and running to My Health records, so that when you go to look at it, you'll find some relevant clinical information in there, clinical content. The good news is that 99% of general practices have already registered and are using My Health record. 99% of pharmacies are registered, and you can see 99% of them have used it. And public hospitals use has grown significantly. 97% of public hospitals, and we're also working with private hospitals, are connected to the system. And the viewing by those clinicians in those hospitals has grown immensely as well. So if you are a specialist and you're working in a public hospital, you could look at how you can access the system through their hospital applications. And that means you can view a person's My Health record if you're working in a specialist clinic within a hospital as well. In terms of what's inside My Health record, there has been significant growth in the amount of information now flowing into the system, and that's continuing to grow and expand and also to change as we make adaptations to the system to enable other documents to come in. But as you can see here, there's over 537 million documents have already been uploaded into the system. So they're available now, including 213 clinical documents. So that includes things like hospital discharge summaries, pathology reports, radiology reports, and so on. I'll show you some of those documents when we go to the demo. This is just to give you a bit of a snapshot overview to sort of bring home the fact that there is that significant clinical content now available. So this screen gives you an overview of the current documents that can be found within a person's My Health record. And on the right-hand side, you can see a list of healthcare provider documents. So they're the ones that are uploaded by clinicians. And the key document there that probably is of interest to you is if a person has a shared health summary. That's a document that's uploaded by their general practitioner usually, or their main regular healthcare provider. And it provides a snapshot of that person's health status in time. So that can be a really useful document to give you a good overview of that patient's current conditions, medications, past medical history, allergies, and so on. That's all provided that that GP has uploaded that shared health summary, and we're encouraging them to do that and put that information in there. That's actually an active thing that they have to do to upload those documents, whereas a whole lot of the other documents on that right-hand side of the screen are actually default to send through the system once that service is connected. So for instance, the hospital discharge summaries are automatically going up into a person's My Health record once that discharge summary is finalised at the hospital end, provided that hospital is connected. Likewise with pathology reports, as long as that lab is connected to the system, then their results will default to go up unless there's a request not to send it up into My Health record, and so on. I won't go through that full list of provided documents. Most of those would probably be fairly self-explanatory to you, but if you do have any questions, please pop them in the chat pane. The other thing to point out is that individual patients or consumers can add information in their My Health record. That's always clearly indicated as patient-entered information, but it can include important things such as if they have a significant allergy, they can add that allergy information to make sure it's available wherever they go. Patients can also upload a copy of their advanced care plans if they have those in place. There's also information that flows through from Medicare or Services Australia, which includes information around MBS claims. So you can actually look up and see if certain items have been recently claimed. That can be useful if you're providing a service that has a Medicare cap. Also organ donor registers and, importantly at the moment, Australian immunisation register information. The other thing to point out is around the middle of this screen in the My Health Record logo, you can see a number of circles. They represent documents that are actually generated by the system to hopefully make your life easier to find the information that you need. I'm sure you can imagine with all these different types of documents, if you just had them in a full list, you'd have to be clicking on each one, opening it up to find the information and digging through to find the information you need. These system-generated overview documents are designed to make that much easier for you so you can quickly get to the information you're looking for and hopefully find that readily within their My Health record. So let's just jump into my live demo. This was going to be a demo. It is based on Genie, but I'll just move into this screen here. Hopefully you are all seeing that. Oh, it's logged me out. Just a moment. I'll have to log back in. Within the new version of Genie, there is a button which indicates that a person has a My Health record. If you've registered your organisation and it's all set up within your system, you'll see a little green icon. And when you click on that button, it will bring up a screen that looks like this. They're using what's called a middleware product, which actually opens what's called this HIPS user interface. So your screen will look a lot like this. As I said before, other softwares will look slightly different. They all have a slightly different look and feel, but we are running virtual classroom sessions. So if you are using a different clinical software and want to know how to find the documents within your system, then I encourage you to join one of those virtual classroom sessions to find out. But this is more to give you a taste of what you can find. So you can see here we've got this patient, our fictitious patient, I should point out, called Lane Buckley. We've landed on her patient summary health record overview page, and right at the top we can see she's got some COVID-19 vaccination information. So just clicking on this drop down here, we can see listed underneath, this is advising us that this information has been sourced from the immunisation register and she's had her 2 doses of the Pfizer vaccine. So that's good news if you were looking to provide some treatment to her and wanted to know if her vaccination status was up to date. Underneath this, you can see there are other drop downs where you can find documents, other documents that have been uploaded to her record since the last shared health summary, and also a link to the most recent shared health summary document. So you can click on those and as you wish. One of the key documents that I like to point out, though, is this one called the Medicines Overview. And if we click along these tabs, you can access a range of different information. This Medicines Overview, as I said, is system generated and brings together information from across that person's My Health record, making it quick and easy for you to find what you're looking for. So this is an overview screen and it has a navigation panel along the top here. The first section that always appears is the allergies and adverse reactions. As I said, these are all fictitious, so don't take too much notice of the detail underneath. But this tab appears. If we click on this, we can see those allergies and adverse reactions listed underneath with the substance, agent and manifestation, and the source documents where there are hyperlinks and possible links back to that source document. So straight away, if you didn't have that allergies information, that could be quite useful for you to be able to quickly see that. And if, as I said, the individual had added information, that would be clearly indicated as patient-entered information here. Clicking across this navigation panel, we can see a list of medicines. So we can see the list here by medicine. This is by date order. You can also sort by active ingredient, and again, links back to the source documents as needed. The other nice thing about this medicines overview is that it gives you a direct link to the most recent shared health summary. So if we click on that, this will give you an idea of the information you can find in that shared health summary document. So you can see here, this has been uploaded by Lane's regular doctor. At the top, we have adverse reactions, then medications, and scrolling down, if I can, sorry, my screen's a bit small, medical history, and the immunisations that have been provided at that particular practice. So that would not be her complete list of vaccinations as held in AIR necessarily. So if you perhaps have received a referral that isn't fully detailed, this can be a really useful document to be able to quickly find and get some further information. And finally, the last tab in this medicines view is the straight to the most recent discharge summary. So if the patient has been in hospital recently, you'll be able to find that discharge summary just clicking on that hyperlink, and you're straight there. You've got a copy of that discharge letter. So you don't have to be spending time chasing that if you didn't directly receive it. So that's the medicines overview screen. I think that's one of the really helpful go-to documents within My Health Record. There are a range of others, as you can see listed here. I'm sure that for you as specialists, you may be interested in perhaps seeing pathology results. Be aware when you click on this link, there are filters in play. So if you need to see earlier documents, and because this is our pretend patient, I know she's got some older documents, expanding that date range will then retrieve that information. And you can then see the tests that she's had recently. Click on the document button. And in this instance, the pathology report's attached as a hyperlink, clicking on there, and you've got the blood results straight in front of you. I know that's really small on your screen, but it's really just to give you the idea that you get that straight away. That's immediately available. The beauty, of course, with that is that any pathology requests that have been made for that patient are then available for you to see, regardless of whether you requested them initially or not. So if someone says, oh, I had a blood test a couple of weeks ago, but I can't remember what it was for, my GP made me do it, have a look in their My Health Record and you could well see those blood results straight away in there. As I said, it is dependent on the pathology lab being connected and actually uploading their reports to My Health Record. We are working with more and more of those lab services to do that. And there is an extensive list on our website of those services that are connected and uploading those reports. The other thing to mention about those reports is if you are the original requester, as I said, you can check a box within your software to say, do not send to My Health Record if it's particularly sensitive information or if the patient requests that it isn't uploaded. But once it is uploaded, it's then available for any other healthcare provider who has access to My Health Record to also be able to see. It's immediately available once it's finalised and uploaded to healthcare providers. But for the individual who can log into their My Health Record and see that information, there is a 7-day delay before they can access and view that report. And that, of course, is to give you as the requesting clinician time to review that result and get back to the patient if needed. The only exception to that is COVID-19 results, which are now made immediately available because we realise that patients need to be able to see those straight away. Of course, that's only for path results that are sent through a lab. RATS tests results do not come in to My Health Record at this stage. And you can see here the other tabs along. I won't go through all of them this evening. As I said, we are running virtual classroom sessions, but that's just to give you a taste of the sorts of information that you can find quickly and easily by having access to My Health Record. I think one of the clinicians that I've worked with previously from Melbourne indicated that she often receives information or a referral for a patient and she thinks, oh, I'll just have a look at their My Health Record as well. And she always finds more information than what she's received in that referral. So it can be really, really useful in that respect. In terms of uploading your specialist letters, this is just some screenshots from Genie software, but as I said, there are other softwares that are building this functionality in. Most of them have built it so that when you create a letter, it's just a matter of that letter automatically going up into My Health Record unless you indicate otherwise. So in this instance in Genie, there's just a checkbox here and it's saying send a copy to My Health Record. So that can be unticked if you wish, but hopefully you realise the benefit of having it in My Health Record for future, for other clinicians to be able to see, and also for the patient to be able to hopefully guide their self-management a bit. Once that letter is finalised and it's clicked as ready to send, then you create your letter as usual, you click save and it's automatically uploaded into My Health Record, as well as sent to your requesting clinician as per usual practice, which is probably what Eric's going to talk about in a little while. And here's an example of the letter that's been uploaded. It's in a PDF format, depending on your software, again, as to how it looks as it gets uploaded, but you can have the option to have it uploaded as a PDF. So the big benefits of My Health Record, as I have kept saying throughout this presentation, is of course ensuring that you have quick and easy access to key health information that hasn't been directly received. Less time and administrative burden for you and your team gathering key patient information, but also saving your business time in terms of having to send information out to others. So if you've uploaded a copy of your letter, instead of your practice manager or support team having to find it, produce another copy and send it, it can just be, you can suggest that they check the person's My Health Record. And of course, what it's all ultimately about is improving clinical decision making by making sure you've got that key clinical information ready to hand when you need it. And of course, avoiding undertaking duplication of tests and scans that don't need to be done if you're able to access that information through the person's record. So I'll just take a breath because I think I'm speaking a million miles an hour. I've had a hectic day. And then we'll go through how to get connected and start using. So there is the way that providers access My Health Record in terms of viewing. That can be via the hospital applications. And as I said, often those applications will actually have that similar look to what I just showed you in the demo, or through conformance software. Or a final option for viewing is through what's called the National Provider Portal. So if you have a look at the list of softwares and find that the software that you use, or that you don't use any software, but you still want to be able to access a person's My Health Record, there is an option that gives you viewing access, and that's called the National Provider Portal, and that allows you to at least see the information. You can't upload through the portal, but you can at least view. And then, as I said, there is the uploading, as I said, via hospital applications. That tends to happen in the background, default to send through the discharge summaries for a hospital stay. But also some hospitals are now uploading other documents, including some specialist letters from outpatient clinics. And as I said, you can also have that happening through your conformance software, depending which software products you use. Check with your software vendor whether they integrate with My Health Record. Patients themselves can view their own My Health Record by logging on through the MyGov portal. They can also access it and look at it through authorised apps, mobile apps, and they can upload, as I said, that's patient-specific information through the portal as well. There is also work being done on a agency-branded My Health app, which will be coming soon. So one of the things that the Digital Health Agency has been doing over the last couple of years is working with software providers to build in that integration with My Health Record and to make it easier for it to work seamlessly for you as specialists. And so you can see here there's a list that are currently in release, others are currently in testing, and others are about to go live. They're in development process as we speak. So if you can't see yours on the list here, don't despair. They may still have some viewing ability for My Health Record, but these are the ones that are working towards that integration of uploading of specialist letters. The great thing about these software products that have done that integration is that they do allow access and viewing of all the documents and overviews that I've just mentioned. And as I said, that easy uploading of your specialist letters as part of your regular workflow. They can also upload copies of prescriptions that you write, and also enable non-clinical staff who are authorised by your organisations, are covered by the organisation's policy, to actually view and collate that information together for you. So, for instance, if you have a practice manager who's been through appropriate training, knows how to use the system, understands privacy and so on, then they can be authorised to open and access that information and provide it to you if needed. And likewise, they can finalise that uploading of specialist letters if you, for instance, use the dictation process. Key things that you need to consider if you are in private practice and looking to get connected to use the system is, of course, to make sure that you have a My Health Records security and access policy in place. There are sample templates available on the web link that Angela will be sharing with you. You also then need to go through a process of getting registered and connected to use the system. So you have to actually put in an application. You have to be working in a registered organisation. We do have guidance and another link that will be sent out in the follow-up email to guide you through all of that. And also you can call out to the PHN for support in that role as well, getting you connected and ready to use. Once you've registered your organisation, you'll need to contact your software provider and get them to configure your software and get it all set up appropriately. Ensure your staff are trained in using the system, and we can help in that space as well. Confirm how you're going to authorise staff and make sure that you're meeting your ongoing participation obligations, which are all spelled out on that webpage that we'll be sending out later. We do, as I said, have connection support available, registration support, so that you can get started and hopefully get started quickly to use the system. We do have a specific connections team at the agency who can support you through that registration process. They can be contacted through that email or that phone number and ask for the specialist connections team. As I mentioned as well, you can contact your primary health network and request support. So if you're in Eastern Melbourne PHN, the contact details on the screen. Otherwise, we've got a link to a PHN locator, so you can find out who your PHN in your area is if you don't already know. And as mentioned earlier, if you are working in the hospital system, find out how to access My Health Record through your hospital applications. Chances are it may already be switched on. Ask your clinical informatics manager or quality manager. They should be able to point you towards the relevant icon in the system, or check your local intranet for information about how to view. So in terms of other useful resources, as I mentioned, we are running virtual classroom sessions where you can find out how to view those documents and many more, and how to use the systems across a range of the different software products. We also have sessions specifically for hospital staff and also for practice managers around practical tips around that background policy and compliance requirements that are in place as part of using the system. So they're all available through those links. And I think I've raced through my presentation, but I'm now ready to answer any questions.
Thanks, Kathy. We have had a couple of questions pop up. So we did have one question from Sean asking, where do we go to sign up for a virtual classroom for medical director? So I think you just answered that in the last slide there. So
yeah, that would be that link there.
They're fantastic. So obviously everyone will receive this this presentation, so they could actually click on those links there that's relevant to their software. Tamara also mentioned that ZMed also has an icon that indicates if a patient has a My Health record. So she was obviously calling out the green icon that's available. So it was just a comment to your presentation there.
The icon can vary depending on which software product as well. So, you know, just learn which icon is relevant in your product. ZMed have also just got a really exciting new release about to come live. So keep an eye out for that if you are a ZMed user. If you upgrade to their newest version, you'll actually be presented with a lot of the My Health Record information straight into your clinical screen for your patients, rather than even having to click on an icon. So that's a nice development as well.
Fantastic. And we've got another one from Sean. Is there any way to access a patient medication past history in a format that can be imported into our clinical software? A number of referrals we get can be pages and can take a lot of time to enter into manually by admin and nurses.
Yeah, that's a good point. So at the moment, no, as far as I know, it can't just seamlessly get integrated into your existing software. But as I said, that medications overview screen that I showed you would give you the most complete information from across the person's My Health record. Of course, you still need to use your due clinical judgment when looking at that list of medicines, because while someone may have been prescribed something, they may not necessarily have ever got that prescription filled, and you still need to ask whether they're actually taking it still. But unfortunately, it doesn't automatically populate into your clinical systems at this stage. Although, as I mentioned, there are some things happening, exciting things happening with some of the software vendors making some changes to how their product fits with My Health record and integrates that information. So at this stage, it would be a matter of saving that medicines list or transcribing it into your product, unfortunately.
Another one from Peter. I think it's more of a comment than a question. Peter mentioned, I've been using this in Genie since the start of the year. However, I've found very few patients have information in their My Health record, and a few public hospitals are uploading discharge summaries. So obviously we're seeing an increase and change there over time, but it's taking time still, isn't it, Kathy?
Yeah, it really varies from state to state. Different jurisdictions have adopted at different times. So depending where you are and where your patient's coming from depends on how much information you find. Also, if you're seeing someone who's been relatively well, it's only as they interact with the healthcare system that information will go into their My Health record. So if they have been reasonably well, you won't find that much in their My Health record initially. It will perhaps some have some Medicare information or their immunisation history, hopefully, but that might be it. But as they interact more with the healthcare system, or if they're in and out of different parts of the healthcare settings, then that information should flow in. And as Angela and I both said, those connections are really coming to the fore now. So I don't know what the stats are like for Victoria. Angela, you're probably more across it in terms of hospital connections, but there is again a list on our website which has all of the different hospitals that are currently uploading to the system, and that is ever expanding.
That's right. And there's an opportunity as well to obviously speak to your patients and encourage them to ask providers to start uploading as well, isn't there?
Of course, yeah.
That's right. One from Alison. Did I understand correctly that pathology results only appear on My Health record 7 days after they are collected? So I think just reconfirming what you were saying before, Kathy.
So no, that's not actually right. So it's as the result or report is finalised, then it is uploaded to My Health record, and it's immediately available to you if you're a healthcare professional to be able to see that information through the person's My Health record. Any healthcare professional, as long as you're providing healthcare to that person, can see that result. But it is a 7-day delay before the patient can view that report through their own My Health record. So they actually see it listed in their document list as a finalised report. They have a little lock icon on it because they can't unlock it for that 7 days. Once it's available, that will change and they can just click on the link and see the report.
Tamara, you've just asked about accessing the links on Kathy's slide. It's when we email that out to you that you'll be able to click on those links. So just wait for the email to come to you in the next day or two, and you'll be able to click on the links to the clinical software simulations relevant to you.
If you do want to jump on before then, you can go to the digitalhealth.gov.au webpage and look at the newsroom events and webinars, and they're all listed in there, the upcoming classroom sessions.
Yeah. Another one from Tamara. Tamara's been busy on the chat. Thanks, Tamara. We've just started using this week My Health record on ZMed and have been amazed with how much information results, discharge summaries are available compared to 2 years ago when it was a dead zone. So
yay, that's great to hear. Lovely.
Yeah.
Excellent. That's what we like to hear.
Another question, can admin and non-clinical staff upload to My Health record from ZMed who could not previously?
So with the new version, that should be enabled. So that was part of that round of industry offer that we had, was that they were going to enable that. So yes, you should be able to do that as long as you're covered by your local practice policy to be able to be authorised to do so. Then yes, that should be possible with the new version.
Thanks, Kathy. That's it for all the questions. I'd like to also say that we are sending out a newsletter in the next couple of weeks, which actually will have links to a lot of these resources that you've been talking about. So we'll ensure that everyone that's here on this webinar tonight receives that as well. So thanks, Kathy. Well, thank you everyone for attending. Firstly, I'd like to thank Kathy from all the way over in WA. I'd like to thank you all, also the attendees for attending tonight. We've got an earlier mark, so I'll let you get back to your evenings. Please, if you have any other questions that we haven't answered, please contact us on the email that we provided on the registration. But if you can please complete your survey as you finish up tonight for all feedback for us all. So we thank you and good night to everyone. Thank you.
Thank you so much.
Good night.
Good night all.